Welcome to the part on pharmacotherapy of hypertension. So in last lecture we studied about different category of drugs that are used for management of hypertension. Now in this lecture we have to study all those drugs one by one in detail. Okay. So first category of drug is angiotensin converting enzyme inhibitor. So here is its mechanism that we already discussed. So here angiotensinogen is converted into angiotensin 1 with the help of renin. Again, this angiotensin 1 is converted to angiotensin 2 with the help of this ACE enzyme. Then the formed angiotensin 2 will bind to the receptors, that is AT1 and AT2. Here the most important receptor is AT1 receptor. So this angiotensin 2 will bind to AT1 receptor and it will show its mechanism, that is vasoconstriction, sodium water retention, then again aldosterone synthesis, and further increase in rise in blood volume, cardiac output, as well as rise in blood pressure. Okay, so if we want to reduce the mechanism that is associated with the hypertension, then we have to minimize the blood volume, cardiac output, and blood pressure. So if we want to reduce this rise in blood pressure, then we have to minimize the activation of the pathway. Okay, if this pathway is activating in excessive manner, then it will cause rise in blood pressure. So we have to minimize the excessive activation of this pathway. So either we can prevent this step, either we can prevent or block this step, or either we can prevent the binding of this synthesized angiotensin 2 to AT1 receptor. And again we can further break the synthesis of aldosterone also. So in this case, that ACE enzyme is playing role here in the conversion of angiotensin 1 to angiotensin 2. So if we are blocking this angiotensin converting enzyme, then further synthesis of angiotensin 2 will not be there, and due to that there will not be any vasoconstriction or rise in blood pressure. Okay, so this is the basic mechanism that angiotensin converting enzyme inhibitors are blocking the angiotensin converting enzyme. Okay, and thereby again they are playing role in case of bradykinin also. So they are blocking the degradation of the bradykinin. So bradykinin, we are knowing that it is associated with different kinds of mechanisms. So it is playing role in cough reflex mechanism also. Again, and due to that, if the bradykinin degradation is blocked, that means its metabolism will not be there, and due to the inhibition of metabolism, the levels of bradykinin gets increased, and rise in bradykinin level will cause the cough reflexes associated with the patient. So that is one of the major side effect which is associated with the angiotensin converting enzyme inhibitors. Okay, now again it is linked with the prostaglandin and prostacyclin release also. So now we are going to study some basic points associated with the category of drugs. Okay, so when we want to start this angiotensin converting enzyme inhibitor category of drugs, so we have to start them with low dose, and then afterwards we can increase the dose, because sudden administration of the category of drug will result in causing of some adverse effects like acute hypertension. Then again there may be sodium water depletion, again heart failure exacerbation, and they may cause some complications which are associated with the elderly patients also. So we have to administer low dose of these drugs, and again we can slightly increase the dose. Again next point is there, that is the drugs that are administered in once a daily, that is in frequency, that means we can administer drug for once a day, but there is one exception, that is captopril, which can be administered 2 to 3 times a day. Why captopril is exception here? Because its absorption is reduced up to 30 to 40% when it is administered with the food. So the captopril absorption is affected by the presence of food, and that's why if absorption is not there, then that drug will not be available for the mechanism, and so we have to give it in means frequencies, that means 2 to 3 times a day. Then they are reducing, of course angiotensin 2 synthesis is not there, and due to that the reduction in the aldosterone will be there, and it can cause the alterations of the potassium concentration. Okay, so If aldosterone is not there, then sodium means whatever sodium excretion will increase, and due to excretion of sodium the potassium will get spared, and due to that the potassium levels will get increased, and it can cause hyperkalemia associated with the patient. So if we are administering these drugs, we have to monitor the potassium levels associated with that patient. Now again they are reducing the GFR levels. So here is one mechanism which can be lowering the GFR. Why GFR lowering is occurring? Because they are reducing the pressure difference which is associated with the afferent and efferent arteriole, and due to that GFR gets reduced. And if suppose GFR is reducing, that means the serum creatinine levels may rise, and due to that it can cause kidney diseases also. Then again we have to consider this point also. Means if we are administering these kinds of drug, then we have to monitor the GFR as well as serum creatinine levels of the patient. Then one of the rare adverse effect associated with the patient is that angioedema. That means the swollen blood vessels are there. But if suppose we are reducing or we are directly withdrawing the drug, then this adverse effect can get minimized. So we can manage that with the help of drug withdrawal process. Then the major side effect associated with the angiotensin converting enzyme inhibitor is that is persistent dry cough, that we already discussed, that is due to the degradation part associated with the bradykinin. So they are inhibiting the degradation of the bradykinin, and this side effect is occurring. Again, these drugs are contraindicated in the pregnancy. So we cannot administer all these kinds of drugs because they are producing the fetal abnormalities and they are causing harm to the fetus. That's why in the third trimester as well as in case of pregnancy, we should not give all those kinds of drugs. Then next category is there, that is angiotensin 2 receptor blockers. So here that is synthesized angiotensin 2 is going to bind to the angiotensin 1 receptor, and if we are blocking this mechanism or this pathway, or we are antagonizing the binding of angiotensin 2 to angiotensin 1 receptor, then the effect of angiotensin 2 will not be there, and due to that reduction of the blood pressure can be achieved. So these agents, angiotensin 2 receptor blockers, are directly antagonizing the angiotensin 1 receptors. But here is one point, that they are not blocking the breakdown of bradykinin, and that's why the reason is here why the persistent rise or the persistent dry curve is not associated with the angiotensin 2 receptor blockers. So it can be one of the advantage. So if the dry curve is severely associated with angiotensin converting enzyme inhibitors, so we can shift to angiotensin 2 receptor blockers. And again, those patients who are tolerant to angiotensin converting enzyme inhibitors, we can shift to ARBs also. These are showing the significant means improvement in case of type 2 diabetes with and nephropathic patient. Again, they can be helpful for the patients with LV dysfunction, and they can be given in combination of other drugs also. But we have to keep in mind that we should not prescribe these ARBs with ACE inhibitors. We are giving them as an alternative therapy. Means if patient is not on a ACE inhibitor, then only we can give ARB, or we can replace ARB with ACE inhibitors also. Now here are some adverse effects associated with the ARB, that is renal insufficiency, hyperkalemia, orthostatic hypotension, and angioedema. So these are the adverse effects which can also be seen in case of angiotensin converting enzyme inhibitors. And again, one major point is that these drugs are also cannot be prescribed in case of pregnancy. So they are contraindicated in pregnancy. Again, the fetal malformations are associated with ARBs, and that's why they should not be given in case of pregnant women.